If I wanted to be pregnant in 2026, here are all the things that I would do as a fertility expert. Everything I'm about to tell you is covered thoroughly in my upcoming book, The Lucky Egg, which is the fertility Bible, telling you everything you need to know about getting pregnant with or without treatment. The first step, if you're on birth control, is to get off of birth control. So when it comes to forms of birth control like IUD, they're immediately reversible once you remove the IUD. Other forms like the Depo shot or even long-term birth control pills, it can take a few months for your ovulation to return. If your period hasn't come back in 6 months, it's time to see an expert. The next step is, are you ovulating? You need to figure out your ovulation pattern. If you're not ovulating, you're not in the game. If your cycles are irregular or absent, this means you should go straight to seeing an expert. But it's really important to know when to time your attempts because the egg, when it's released, only lasts for 12 to 24 hours. And the sperm only hangs out for about 3 to 5 days. So you really want to concentrate your efforts in that 2 to 3 day window leading up to ovulation. So the key is to use a calendar to track the first day of menstrual flow and see if that is a regular interval and use that information to figure out your fertile window. You can also use ovulation predictor kits. Next, make sure you're cutting out smoking or exposure to secondhand smoke, and that means cigarettes and, yes, even weed. Cigarettes can accelerate the rate at which you lose your eggs. It can increase your risk of miscarriage and preterm birth. Cut back on drinking. Minimal alcohol intake, less than 4 drinks in a given week, is really the guideline. And when it comes to caffeine, you want to start cutting down to no more than 1 cup of coffee a day, keeping it under 200 milligrams of caffeine intake per day, especially once pregnant. If you're trying to be pregnant in 2026, that's right around the corner, so get on prenatal vitamins, ideally 3 months preconception, containing folic acid to prevent neural tube defects. I'd also take a little extra vitamin D since I'm mildly deficient, and we're heading into winter, and we know vitamin D plays such an important role in many different aspects of reproductive health. I would also start taking CoQ10, coenzyme Q10, 600 milligrams per day. Both studies in animal and human models suggest a potential benefit on pregnancy rates, whether you're trying on your own or with treatment. It has a low risk of side effects, and it's unlikely to have any adverse effects and could have a potential benefit. I would get up to date with your overall medical surveillance, go see your primary care doctor and get a full physical, review your medical history, any chronic conditions like do you have prediabetes, diabetes, high blood pressure, any issues with your thyroid, anything that's not well controlled. It's time to get a handle on it now because it could impact your overall health and your fertility and also your well-being once you are pregnant. When it comes to diet, I would focus on a Mediterranean-style diet with lots of plants, lean proteins, and healthy fat sources like olive oil and avocado. And if I had known risk factors or signs or symptoms of insulin resistance, a history of PCOS, prediabetes or diabetes in my family, or weight gain that doesn't respond to lifestyle measures, I would take action now. That might include weight loss measures through diet and exercise, but also you may require the help of medications like metformin or GLP-1 agonists. In some cases, this has helped my patients tremendously improve their metabolic health and support ovulation. I'd also start thinking critically about the things that I'm putting in and on my body when it comes to endocrine disrupting chemicals and reducing exposure to microplastics or unnecessary chemical exposure to fragrance. All of these should be easy, small swaps that you can make to reduce your overall exposure and improve your overall long-term health and fertility. But you don't have to live in a bubble. If you have known gynecologic issues like fibroids, PCOS, or endometriosis, or maybe you've never been diagnosed, but you've always had problematic periods that are painful, heavy, or irregular, then you need to seek treatment. And I highly recommend getting pelvic sonogram or some sort of baseline imaging before getting pregnant so that you're identifying things like a large fibroid that's taking up space in the pelvic cavity to avoid the risk of miscarriage and make sure you're addressing those types of issues before getting pregnant. And if you're doing this with a partner, I think it's really smart and proactive to do genetic carrier screening. Most people wait till they're already pregnant, and then both partners will do this testing and see if there's crossover between the mutations that they carry. And then you know what to test the pregnancy for by 11 to 12 weeks. But I think it makes sense to do this beforehand. You already know you want to join your DNA. Why not do the risk assessment beforehand? If you find something that could lead to proactive steps, like creating embryos and genetically testing them to avoid passing on a serious medical condition. Finally, create a timeline. It's not about putting pressure on yourself, but having a roadmap means you're less likely to waste valuable time. So if you're under the age of 35, I would check in after 12 months of trying. Persistence will often pay off. If you're between 35 and 40, don't wait longer than 6 months. And if you're in your 40s, it's never too early to talk to a fertility expert, especially after 3 months of trying, but I would welcome that conversation even earlier. This is not about over-obsessing and being perfect. It's about being proactive. These are the important points to cover with my patients or with friends or family members that are asking me for advice. This is exactly what I would focus on if I was trying to be pregnant in 2026. My book comes out in January 2026. Don't forget to pick it up because this covers everything you need to know about optimizing your body for trying to get pregnant now and when to seek help, how to get the best help, and everything you would need to know if you need fertility treatment.